U.S. health officials are urging doctors to screen pregnant women and new mothers for depression. Joining us now to talk about this is Dr. Suzanne Gilberg-Lenz. Doctor, thank you for being here.
Thanks for having me.
I love this topic because it happens to so many women, yet we don't talk about it a lot because it's like hush-hush. It can be embarrassing.
You nailed the top two things. People don't like to talk about this. They're ashamed and they minimize. And it's extremely common. 1 in 7 women have depression during or after pregnancy. But it has lasting effects on the family and on the baby, on their development. So it's so important to address it.
Yeah, absolutely, and I'm glad we're talking about it. When I had my son, I had what doctors later would call the baby blues for a couple of weeks. Now, that's different than depression.
Absolutely. This is a more chronic condition, and it's more serious. So first of all, we see it sometimes during the pregnancy, and then it can last throughout and postpartum.
Okay, so if a pregnant mother or maybe someone who just had a baby is watching, what would you advise them to get ahead of this problem?
The issue here is to make your care providers aware of any symptoms you're suffering from, or if you have a family history of depression or anxiety, any mood disorders, because again, people are ashamed, they don't want to talk about it.
Yeah.
But if we know, then we can have a plan of action going forward. It's so hard to ask for help, especially as a mom, it's so hard to ask for help. You want to do it all.
Yeah, and you feel guilty. Don't feel guilty. That mommy guilt will bite you. Always great information. Dr. Suzanne, thank you.